In talking about inflammation, we talked about the body's defense systems and the non-specific physical and chemical barriers, and then the inflammation process, which is part of our defense systems, and the initiation into wound healing. Well, if everything gets past the physical and chemical barriers and the non-specific barriers, now we have to have another response. And the immune response is far more specific, interesting, and long-lasting. So the learning objectives for the entire chapter, and so there are going to be a couple videos on these, defining the basic terminology associated with immune system function and dysfunction, types of immunity, factors that affect immunity, discussing immune suppression and the associated risks, the effects of exercise on the immune system. Good to know. I just read a really interesting article about that. Describing autoimmune diseases and providing selected examples. That will be in the second lecture. Discussing immunodeficiency and hypersensitivity reactions, and that will also be in the second lecture. So the key concept in the chapter is that we're exposed to so many potentially dangerous pathogens every day. And our immune system responses keep us from being harmed by these substances most of the time. So if you have a healthy immune system and things go as they should, then you should never get sick. We know that's not always true, but lots of different things can stimulate an immune response. So bacteria or viruses or fungi, so our pathogens out there, cancer cells in our body can stimulate an immune response. Even our own normal cells can stimulate an abnormal immune response in autoimmune conditions, and we'll talk about those. But for PTAs, it's important for us to understand the immune responses to help protect our patients and ourselves from infection and recognize when a patient might be immunocompromised and what steps you have to take if that's the case. So pretty important. There's there are a couple videos in the chapter which are really kind of nice. So if you want to take a little view of those videos, there's some supplemental videos in the module in Canvas that it's optional for you to watch, certainly. Any of those supplemental videos that are not in the chapter, but they're in the Canvas, they're just ones that I've run across that I thought, oh, that's interesting. And some of the ones that I really like are short. They're like 1 or 2 minutes long, and they kind of sum everything up. For a review of a particular system, one of those short little videos is nice to watch, but you will not be responsible for any of the information in those supplemental videos. The ones in the book, um, definitely watch those, but the supplemental ones, they're just in your spare time if you want to watch those. So just to review what we talked about in the inflammation chapter, our first line defense is our innate non-specific immunity. So it's the same response to any pathogen and no memories formed, includes physical and chemical barriers. So that includes things like our skin and our chemical responses and our stomach acid. That's a chemical response. But it's just anything that comes along first line of defense. Our passive immunity is antibodies that are received from an external source. So any pathogen or foreign foreign cell that comes into our system is called an antigen. And our response to antigens in the immune system are often antibodies that are key to a specific antigen. In passive immunity, we also don't form any memory cells. It's temporary protection. So one of the good examples of passive immunity is you get antibodies from your mother through the placenta before you're born, and that's just to get you through the first few days of life when you don't have an immune system yet, or you have an immune system, but it's raw and untrained. You've got to train it. So the third line of defense, so that's what we've talked about so far, is just the innate non-specific immunity. We haven't talked about passive immunity yet, but here it is. When things get past that first line of defense, Then we need our adaptive or specific immunity, which is a targeted response. In the case of adapted or specific immunity, the immune system forms memory cells, which remember pathogens that you have encountered and remembers the response to them. So you get a faster response on re-exposure, and it involves T cells and B cells, or T lymphocytes and B lymphocytes, and we'll talk about the different types of cells in the immune system. So the advantage of adaptive immunity is anything you encounter, it can develop a response to. And as long as it doesn't kill you on the first exposure, you're okay. If it kills you on the first exposure, well, that's no good. But the the fact that we save a memory of it, and that's what babies don't have. That's why they need antibodies from their mother. They don't have any memory cells because they've never been exposed to any pathogens. And so they need to build their own memory cells, build their own little library of memory cells. So our innate non-specific immunity is our very general first line defense against any cell or substance that the body recognizes as potentially harmful or not belonging to the body. So the body has to identify your own cells as self cells, and anything that isn't identified as self cells is non-self, and that's what the immune system is going to combat. So the components of innate or non-specific immunity include physical barriers, like the skin and the mucosa, chemical barriers like the sweat, tears, and stomach acid, cellular components, neutrophils, monocytes, and macrophages. They're out there just kind of cleaning things up all the time, and they're not looking for a specific antigen. Inflammatory mediators. So once the inflammation process gets initiated, now we have basophils and mast cells and eosinophils, which are basophils and eosinophils are white blood cells, leukocytes, and mast cells are other cells associated with the immune system. And mast cells create chemical messengers that mediate the immune and inflammatory responses. Then we also have these great cells called natural killer cells, NK cells, and they're out there patrolling, looking for anything that might get out of hand. If it looks for damaged cells or precancerous cells or weird cells, anything that's wrong, and it'll destroy those cells. So one of the things that happens when we get older, why we have a diminished immune response as we get older, is that we have fewer natural killer cells looking for those things. The key feature of innate immunity is that phagocytosis is the major form of destruction of foreign cells in the innate response. Every exposure triggers the same response. There's no memory or learning. So like new exposure, same response. New and new pathogens, same response. So with the non-specific, we're just born with it. That's why it's called innate. And we don't have to develop anything. It's always the same response. So passive immunity is part of that innate response. And so the definition of passive immunity is that it's specific immunity to certain things with no memory cell formation. The antibodies are received from an external source. So naturally, passive acquired immunity is from our mother, from the mother to the fetus through the placenta. There are also antibodies in breast milk, which is why breastfeeding is good. And it provides temporary protection to newborns until they can start forming their own antibodies and memory cells and everything. So one of the reasons why little kids get sick so much is because they have undeveloped immune systems, and they have to get sick. If you kept your kid in a little bubble all the time, they would never develop their immune system, and they would have a deficient immune system. So they have to get sick. So every time your kid comes home with a cold, say, thank you. Thank you for developing your immune system. And, wash your hands. You can also get artificial passive acquired immunity, where antibodies or sensitized lymphocytes are injected. And rabies are a good example, or antivenom for a snake bite. It's immediate but temporary protection. Another example of this is before they had hepatitis vaccines, if you got exposed to hepatitis when you worked at the hospital or on the ambulance, they would give you um, a serum that had antibodies to the hepatitis virus in it. Um, and the gamma globulins are the antibodies, and they would give you those injections to hope that you didn't develop hepatitis. Now there are vaccines for a lot of the forms of hepatitis, and so get them. If you work in healthcare, get them. The key point, though, is in both types of passive immunity, natural and artificial, no memory cells are formed. So the immunity only lasts until the antibodies are used up, processed, and eliminated by the body. So when we now get to acquired or adaptive specific immunity, B cells and T cells are activated to create memory cells that remember antigens for faster future responses. So the key players in specific or adapted immunity are B cells or B lymphocytes, which become memory cells, and plasma cells that create antibodies, and helper T cells, which do so much for us. They're called CD4 cells, and they assist in the creation of antibodies and memory cells, and cytotoxic T cells, which are like assassins of the natural killer cells. So the body sends them out to kill something specifically. Just interesting. So cytotoxic T cells directly kill infected, cancerous, or unwanted cells, and those are the CD8 cells. So the advantage of specific adaptive immunity is that memory cells provide a rapid targeted response when you get re-exposed to the same antigen. So you can have active acquired immunity, a natural active acquired immunity, where your body produces its own antibodies, or you can have um, humoral or cell-mediated responses, and there are different pathways for different threats, and we'll talk about it. So with your active acquired immunity, um, you gain immunity through the body's own production of antibodies and memory cells. So it can be natural or artificial. So natural active immunity is you actually get the disease. You experience the actual disease. You meet a disease pathogen out in the wild, and your body has a response to it. It mounts that full immune response and saves a memory cell. And it often provides lifelong immunity. So chickenpox and measles, they're a good example of that. Measles, if it doesn't kill you, you'll be immune to it. If it kills you, well, that's the problem with natural active immunity. If the first exposure kills you, then you can never develop that secondary response. That was the problem with COVID early on. The early stages of COVID, the first exposure often killed people in a large percentage of cases. So they never had the chance to develop a natural immune response, which is, that's a bummer. But the other problem with COVID is that it was a new virus. Nobody in the world had immunity to it because nobody had ever been exposed to it. So all of us who were exposed experienced our first exposure to it. And if the first exposure kills you, then you don't ever have a chance to mount a second immune response. So with artificial active immunity, you are vaccinated with either dead or weakened pathogens. So you get immune response with minimal disease symptoms or no disease symptoms. And that gives you lifelong protection as long as the virus doesn't mutate. If it mutates, then you need a booster later on. So the flu shot and COVID vaccines, they're an example of artificial active immunity. The reason they don't give you lifelong protection is because the viruses mutate quickly. So both natural and artificial acquired immunity create memory cells for long-term protection. Often they last a lifetime, but you're only immune to the first one you were exposed to. If there's a mutated form of the virus, you might not be immune to that. And that's where booster vaccines come in. So you might already know this about me. I'm pro-vaccine. It's like whatever vaccination there is out there, give it to me. And being in healthcare where we deal with people who are immune suppressed, it is our responsibility as healthcare professionals to get vaccines. And I've heard people say, well, I don't want to get a vaccine because it makes me sick. It doesn't make you sick. It mounts an immune response, and that's what it's supposed to do. So you might have symptoms of an immune response, and that's what it's supposed to do. So then you have a memory cell, and then when you encounter the pathogen, the body knows what to do. And the thing doesn't have a chance to kill you on the first exposure. So, humoral response versus cell-mediated response. So, the humoral response, the main players in the humoral response are B lymphocytes or B cells. And the way it happens is the B cell engulfs the antigen. And the antigen fragments are displayed on the B cell surface. Macrophages also engulf antigens and display their pathogens, so the immune system knows what they're looking for. It's like a wanted poster. Like when the immune system cells display the pathogens on their surfaces, it's telling the body, okay, this is what we're looking for. Get at it, start killing it. So the helper T cell is going to attach to those antigen fragments and release cytokines, which are chemical mediators, which cause B cells to mature into plasma cells. And so when the B cell matures into a plasma cell, it starts making lots and lots of copies of itself, and the copies start making antibodies. Some of those copies become memory cells that you save in your little cell library forever, hopefully. The result is antibodies are produced. The antibodies tag the antigen for destruction. And then either the cytotoxic T cells or the macrophages destroy the pathogen. So it's called humoral because it's not cell to cell. It's the production of antibodies that happens. The cellular immunity on the cell-mediated response, on the other hand, the main players are T cells or T lymphocytes. So the target usually is virus-infected cells, cancer cells, or transplanted cells. So a virus-infected cell is interesting. We'll talk about this when we talk about viruses. But the T cells, we have helper T cells, which are those CD4s, and they enhance other immune cells. So they release chemical messengers that call other immune cells to the area. They see that the B cells got an antigen and they stimulate the B cells to turn into plasma cells. So there are lots of advantages. The helper T cells are the workhorses of the immune system. And some immunodeficient diseases target those CD4 cells. So if you don't have enough of them, that's a problem. Cytotoxic T cells or the CD8 cells, they kill target cells. So the target cells have been marked now by the antibodies, and the cytotoxic T cells go out to get them. Suppressor T cells, they turn off the immune response or they diminish the immune response because you don't want your immune response to go on indefinitely. It could start like recognizing your own cells as pathogens, and then that's trouble. That's called autoimmune disease, and we'll talk about that. The key difference between humoral and cellular cell-mediated response is that the T cells have to come in direct contact with infected cells to become activated. The B cells just need chemical messengers to become activated. So sensitized B or T cells then start doing their job. And so some immune disorders have to do with inappropriately sensitized B or T cells. We'll talk about them. So, whoops. There are lots of factors that affect immunity. There are genetic factors. People are born with certain immune predispositions. Like some people just have a super strong immune system, and some people have a super weak immune system. And some genetic factors may require environmental triggers to be activated, like poison ivy sensitivity varies among individuals. If you have the genetic predisposition to poison ivy sensitivity. Probably the first time you are exposed to poison ivy, you will not um, have a reaction, but the second time, now your cells are sensitized and you might have a reaction. So I grew up on the East Coast and there's poison ivy everywhere there, and there's woods everywhere there. So if you just go like, oh, let's go for a nice hike in the woods, if you're sensitive to poison ivy, you might get it just from the air, get that rash. Um, your age is a big factor affecting immunity. The very young, so like babies with undeveloped immune systems, and very old generally have less robust immune responses than other age groups. So we all know that little kids get sick more often than bigger kids, and old people get sick more often than younger people. So the just when you're little, your immune system just isn't developed. When you're elderly, you're you have fewer natural killer cells, your body isn't as responsive, your immune system is diminished a little bit, and so you're more susceptible to disease. Your health status has a big effect on immunity. If you have multiple comorbidities, your body is busy. It reduces your immune response because it's dealing with all this other stuff. Your overall health affects immune function. So I always say to people, um, knock on wood, I don't get sick very often. And people say, well, what's your secret? And here's my secret: eat well, exercise a lot, exercise moderately, get good sleep, and don't hang around people with immature immune systems. That doesn't work for everybody. But your overall health does affect your immune system. So if you're generally more healthy, you're going to have a stronger immune system. So as PTAs, it's so important that we pay careful attention to hygiene, especially hand hygiene. Wash your hands like a million times a day. PPE when it's appropriate, and aseptic technique. When are we going to use sterile technique, which you'll be learning this summer or in the fall? Technique that aseptic technique is really important when you're working with vulnerable populations. If you're working with someone who's going through cancer treatment, you have to be so careful. If someone has neutropenia, which means they don't have enough neutrophils, that's our non-specific response, you need to wear more PPE and use more sterile technique. So it's really important to know your patient's health status and to pay careful attention to these things. You don't want to make people sick. We want to make people well, right? So there are lifestyle factors that affect immunity, factors that can impair immunity. Poor diet. If you're not getting enough vitamins and phytonutrients and whatnot, then your immune system's gonna be impaired. If you don't get enough sleep, if you're under chronic stress, if you are obesity because your body has more stuff to process, it's harder. Excessive alcohol use. Alcohol is damaging to cells. It's one of those chemical damaging things. Drug use, same thing. So you have these chemicals damaging your cells, you're not going to have an adequate response. So factors that support immunity, like I was saying, balanced nutrition, regular moderate exercise. We'll talk about how strenuous exercise affects the immune system. Get enough sleep, manage your stress. So remember, it's not what you're dealt, it's how you deal with it. So the stress management is really important for supporting immunity. Good hygiene practices: wash your hands. Washing your hands is one of the most important hygiene practices you can do on a regular basis to stop the spread of infection. Access to healthcare is really important for supporting immunity. Availability of adequate preventative, secondary, and tertiary care is important for maintaining appropriate immune responses in individuals and communities. And that's an issue. We'll talk more about that. So medications can often have an effect on the immune system. In fact, a lot of medications can suppress the immune system. If you're on a medication that suppresses your immune system, it makes you more vulnerable to common pathogens. So people who are on organ transplant medications, they are immunosuppressants to keep your immune system from rejecting the new organ. That's pretty important. If you are on, there's a whole class of medications to treat a lot of different autoimmune disorders, like Humira is one of them used to treat rheumatoid arthritis and a lot of other autoimmune conditions, and those are immunosuppressant medications. So the immunosuppressant medications are prescribed to reduce rejection risk or to diminish autoimmune responses, but they increase susceptibility to infection. So watch those drug ads on TV and figure out which ones are immunosuppressants. Chemotherapy and radiation target cancer cells, but they also destroy normal immune cells. So it's not just the bad cells that they get a lot of cells. And so that can suppress your immune system. The steroid medications, prednisone, hydrocortisone, prednisolone, methylprednisolone, used for lots of different conditions, can interfere with inflammation and the immunity process. Say that you have plantar fasciitis and you have to get a cortisone injection in your foot. That's going to temporarily diminish your immune response. So really think about it when you look at medication lists that people are on. Are these things going to be diminishing their immune response? So exercise does have a good and bad effect on immunity. Moderate exercise boosts the immune response and enhances overall immune function, and supports a healthy immune system. Regular activity is recommended. We know that. The World Health Organization recommends 150 minutes of moderate exercise every week. We could do that. That's easy. Extreme exercise may temporarily decrease immune function. Usually occurs after unusually long or difficult sessions. Like, say you're training for a marathon or something, and when you run the marathon, that your immune system will be diminished for a certain amount of time afterwards. There is a recovery period that is needed, but then your function returns to normal levels. So extreme exercise doesn't permanently diminish your immune system, but it temporarily decreases immune function. So that's something to think about if you're doing extreme sports or any kind of extreme exercise. So it's important for us to be able to develop appropriate exercise programs that support rather than compromise immune function. So after recovery from extreme exercise, immune response returns to normal functional levels. That is important. So extreme exercise isn't the worst thing, but you should know that it diminishes your immune response for the recovery period.